Hi everyone, my name is Amanda and I would like to share some of my research with you regarding cervical cancer and the use of the Gardasil vaccine, which you can find on my talking poster here. I chose these colors because they are, the teal is the cervical cancer awareness color and the purple is for all gynecologic cancers. I will start with letting you know that most people don't know this, but all women are actually at risk for cervical cancer. And I work on a cancer unit, so I see many female patients who have or have had cervical cancer. So I thought, with seeing that on a daily basis, that it would be interesting to do some research on Gardasil and its effect on cervical cancer. So I came up with this PICO question that in women less than 65 years of age, how does the administration of Gardasil combined with a yearly pap smear actually influence the incidence and detection of cervical cancer as compared to those who have not had the Gardasil vaccine like myself? There are more than 40 strains of the human papillomavirus, also known as HPV, that can affect the genital area, mouth, and throat, making HPV the most common sexually transmitted infection in the United States today. And the CDC recommends that the Gardasil vaccine be given to preteen girls from the age of 11 to 12 to ensure that this protection is exposed to these children prior to them actually being exposed to the virus. With cervical cancer being the easiest gynecologic cancer to prevent by having regular pap testing, studies are exhibiting remarkable reductions in cervical cancer incidence and mortality just by patients having the vaccine. The pap test, which most of you are aware of, is recommended for all women between the ages of 21 and 65. And with the use of the Gardasil vaccine as prophylactic treatment, the vaccine induces high initial serum HPV type specific antibodies that neutralize the infection of the HPV viron. But we need to keep in mind that the vaccine only protects against 70% of those cases of cervical cancer. So with this limited protection, it's necessary to follow up the vaccine with your regular screening of your pap smear to reduce the overall lifetime risk of cervical cancer. What I have found in my research, which you can find here on my poster, is that the data strongly supports a catch-up vaccination program with Gardasil in the general population of females 16 to 25. And cervical screening programs are quite successful and cost-effective as compared to those that do not get the vaccine or do not go in for your follow-up screening. With having the vaccine and the screening, it's found that the risk of cervical cancer can actually be reduced up to 94%, making this the best option based on evidence-based research to protect against the disease. It's very important, though, that health initiatives directly focus on young women with the target of improving knowledge about the vaccine and the screenings, as well as participating in these screening programs. This is especially true since the duration of the vaccine's efficacy is unknown past 5 years, so these education programs need to be encouraged to discuss the shortcomings of current vaccines available and the continued need for screening in vaccinating women. In conclusion, I'd like to leave you with a few points, which you can also find on my poster, that cervical cancer can be found with routine pap testing and follow-up of abnormal results. If you have an abnormal pap, you need to go back and continue so that things don't progress. Abnormal cells often become normal over time, but sometimes they turn into cancer cells, so not all the time. And these cells can usually be treated depending on their severity and on the age of the women, her past medical history, and other test results. An HPV DNA test, which can find certain HPV types on a woman's cervix, may also be used during this pap testing in certain cases. And even women who were vaccinated with the Gardasil vaccine when they were younger need cervical cancer screening because the vaccine does not protect, like I said, against all cervical cancers. Like any vaccine or medicine, though, Gardasil can have some side effects. They're not typically anything that's serious side effects, and the benefits of the vaccination far outweigh the potential risk of any side effects. So together, with the Gardasil vaccine and routine cervical cancer screening, there is substantial reductions in the burden of clinical HPV disease. So that pretty much sums up all of my poster here, and I hope you enjoyed listening. Thank you.